Hi everyone, my name is Linda Vang, and today I will be presenting about botulism. So what is botulism? Well, botulism is a rare but serious paralytic illness caused by a nerve toxin that is produced by the bacteria called Clostridium botulinum. It is characterized by symmetric descending flaccid paralysis of motor and autonomic nerves, always beginning with the cranial nerve. There are 5 main kinds of botulism, which is foodborne, wound, infant, adult intestinal, and iatrogenic. What is the agent of botulism? The etiological agent is a pollen neurotoxin produced from Clostridium botulinum, spore-forming bacteria. There are 7 types of botulism toxin designated by the letters A through G. Only types A, B, E, and F causes illnesses in humans. Clostridium botulinum can be found in soil. These rod-shaped organisms grow best in low oxygen conditions. The bacteria form spores, which allow them to survive in a dormant state until exposed to conditions that can support their growth. Exposure is often associated with foodborne. Foodborne botulism follows ingestions of toxin produced in food by the bacteria, that is usually home canned foods prepared in unsafe manners. Wound botulism occurs when spores germinate in wounds, and infant botulism is caused by consuming the spores of the botulinum bacteria, which then grows in the intestines and releases toxin. Classic symptoms of botulism include double vision, blurred vision, drooping eyelids, slurred speech, difficulty swallowing, dry mouth, and muscle weakness. All these are symptoms of the muscle paralysis caused by the bacterial toxin. If untreated, these symptoms may progress to cause paralysis of the respiratory muscles, arms, legs, and trunk. In foodborne botulism, symptoms generally begin about 18 to 36 hours after eating a contaminated food, but they can occur as early as 6 hours or as late as 10 days. Infants with botulism appear lethargic, fed poorly, are constipated, and have a weak cry and poor muscle tone. Many cases of botulism are preventable. Foodborne botulism has often been from home canned food with low acidic content, such as asparagus, green bean, beets, and corn, and is caused by failure to follow proper canning methods. However, unusual sources are found every decade, with the common problem of improper handling during manufacturing or by the consumers, and some examples are canned cheese, garlic in oil, tomato, carrot juice, or potatoes wrapped in foil. In Alaska, foodborne illnesses are mainly by fermented fish. Persons who do home canning should follow strict hygienic procedures to reduce contamination of foods and carefully follow instruction on safe home canning and how to use pressure cookers or canners. Or they should follow services from the USDA. Oil infused with garlic or herbs should be refrigerated. Potatoes which have been baked while wrapped in aluminum foil should be kept hot until served or refrigerated. Because the botulism toxin is destroyed by high temperatures, persons who eat home canned food should consider boiling the food for at least 10 minutes prior to eating to ensure safety. Wound botulism can be prevented by promptly seeking medical attention or by not using injectable street drugs. Most infant botulism cases cannot be prevented because the bacteria that causes this disease is in the soil and dust. The bacteria can be found inside home, on floors, carpet, and countertops even after cleaning. Honey contains the bacteria that causes infant botulism, so children less than 12 months old should not be fed honey. Honey is safe for persons 1 year of age and older.